Hey nurse, let me ask you something. When you hear lung cancer, does it feel like one of those topics that's just too heavy, too complex, and hard to fully understand? Because a lot of students try to memorize types, symptoms, and facts, but they never truly understand what's actually happening inside the lungs. And that's why they get confused during exams. But today, I'm going to break this down in a simple, structured way. So you don't just memorize lung cancer, you actually understand it. Welcome to part 4 of our lung disease breakdown series. So far, we've covered infectious, obstructive, and restrictive lung diseases. And now we're moving into neoplastic lung diseases, which simply means cancer of the lungs. And this is where things become more serious, because now we're dealing with abnormal cell growth. Before we go into types and symptoms, I want you to understand the big picture. Cancer is not just one disease, and it's a process. Cells lose control. They grow uncontrollably. They ignore normal body signals. And in the lungs, this leads to tumor formation. Here's the key concept you need to lock in. Neoplastic lung diseases equal uncontrolled growth of abnormal cells in the lungs. These cells grow rapidly, don't die when they should, and invade surrounding tissues. This spreading process is called metastasis. This topic is very important for exams because it combines respiratory symptoms, systemic symptoms, and disease progression. So the NCLEX is testing your ability to recognize patterns, not just memorize definitions. Now let's break lung cancer into its two main categories, small cell carcinoma and non-small cell lung cancer. Let's start with small cell carcinoma. This type is highly aggressive, fast-growing, and rapidly spreading. So when you see small cell, think fast progression, think early metastasis. These patients often present at later stages because the disease spreads quickly. Now let's look at non-small cell lung cancer. This includes adenocarcinoma and squamous cell carcinoma. This type grows more slowly, but it still causes serious damage over time. So compared to small cell, it's slower, but still dangerous. As cancer develops, tumors begin to form and grow, taking up space and blocking airflow. Over time, gas exchange becomes impaired and oxygen levels drop. And here's something many students miss. Cancer doesn't just affect the lungs, it affects the entire body. Weight loss, fatigue, and weakness. These are systemic effects of cancer. So what symptoms should you expect? Persistent cough, coughing up blood, or hemoptysis, chest pain, and shortness of breath. Here's your high-yield NCLEX tip. Small cell equals fast, aggressive, spreads early. Non-small cell equals slower progression. Remember this to eliminate wrong answers. If you're ready to stop guessing and actually understand what you're studying, pass your next exam using RN and LVN Refresher Online Help from Gab-Nic Excelsior Nursing Tutoring Center.